Why would the world's most experienced orthopedic surgeon say no to more surgeries? Think about it. Do you believe more surgeries automatically means better care? Or might a truly world-class surgeon choose to do fewer so every patient they do help actually gets more? Today, we're discussing why focusing on fewer hip and knee surgeries leads to better, more personalized care for you. If you're considering a hip or knee replacement and you want a surgeon who listens to you, gives you the time, attention, and focus you deserve, and you're not just another slot in their busy OR schedule, then this video is for you. I'm Tyler Goldberg, a concierge hip and knee replacement surgeon here in Austin, Texas. And for the last 25 years and 12,000 surgeries, I've seen patients literally transform physically and mentally. Ready? Let's hit it. Ever since med school, the surgeon work method has always been hammered into our heads. Volume, volume, and more volume. The traditional surgical mindset is all about maxing the number of patients you can cycle through a clinic and through the surgery theaters. It's a game of not how good you are, but how many you do. Consequently, we judge ourselves by volume. If you do more, you're better. Unfortunately, as orthopedic surgeons chase volume, patients get overlooked. They are reduced to just being a number in a never-ending conveyor belt of rushed hip and knee replacements. The result is obvious: impersonal care for the patient and fatigued surgeons. Somewhere along the line, the focus on quantity can overshadow quality. In this volume-driven environment, waiting rooms fill up, consultations become rushed, and patients start to feel like a number on the assembly line. Let me ask you truthfully, when was the last time you felt your doctor sat down and truly listened to your issue with a heartfelt empathy like you're a unique individual patient? But you see, that's not the orthopedic surgery model. We're supposed to be hamsters running on that never-ending volume hamster wheel. But I reject that. It's not about churning out widgets. Precision, focus, and personal care matter so much more to me. Is it ridiculous to want your surgeon to be as present and prepared for you as possible? That's the question that changed everything for me. Several years back, I started to feel the toll of volume surgery. Not just the physical fatigue, but the worry about long-term outcomes. While surgically, I felt I was delivering my absolute best technical skills possible, I realized I wasn't able to give every patient the attention they deserved out of the operating room. I know that patients desperately want their surgeons to listen to them, and I was guilty of not listening. And that's not me. In my own example, I'm a surgeon's surgeon, meaning I operate much more than most orthopedic surgeons because that's simply the patient population I see. But I often ask myself, is quantity really the path to excellence? To put it in perspective, imagine if your airline pilot flew 10 times the normal schedule. Would you feel confident their performance was at their peak? That answer is obvious. I think surgery is no different. For me, I knew it was time to change. I wanted every patient to truly get my best, unrushed, undistracted, and genuinely present for each one of you. I'm not chasing a number anymore. I'm chasing you and your results. And for those few that are willing to go with me, it's going to be a life-transforming journey. My response? I said no to the status quo. I risked everything and shifted to a concierge model, a dramatically different approach to orthopedic care for hip and knee surgery patients in Austin. You benefit from more time with me, deeper connections, and thoughtfully crafted joint replacement plans before and after surgery. Everything you need around surgery is taken care of. For me, I finally get to deliver the level of care I went to med school to do. I'll give you a quick example. I give my knee replacement patients a medication map. It's a simple chart that outlines when and what medicines they should take and at what time they should take it. Before, I just prescribed medicines and basically told the patients they were on their own and figure it out. Don't call us if you have a question, it's on you. Through the concierge journey, I've lived the experience with my patients, and I'm embarrassed to say it took me 25 years to figure out that simple fix that changes your postoperative care. It was a simple fix, but it helps you so much. And interestingly enough, I've noticed the amount of narcotics a patient needs after surgery has simply dropped just by being organized and planned. Another quick one. I'm probably one of the few orthopedic surgeons in the world that knows exactly how patients feel on a day-by-day basis after their surgery, because I talk to my patients on a daily basis, not just a regular follow-up at 6 weeks. I do it daily. Do most surgeons know that patients are constipated on post-op day 4? I bet not, actually. My patients receive information of what to do when that uncomfortable feeling arrives. My returning patients know the value of long-term relationships, and the consistent support. In my practice, I offer tiers or levels of concierge care. They are offers that patients can take or not take. Tier 1 provides all the items a patient will need around their surgery with the additional benefit of a concierge navigator to help every step of the way. For the more discerning, value-driven patient, Tier 2 provides access to an alternative scheduling algorithm, a protection plan, and a direct line to me, your surgeon, so you have peace of mind your questions and concerns are always addressed quickly. There is a Tier 3 offering, of course, for those wanting the best of the best and who need more help around their surgery. The benefit is obvious. You get more time with me, you get listened to, you get the stuff you need around your surgery without spending time on Dr. Google trying to figure it out. You get deeper connections with your care team and thoughtfully crafted care pathways before and after surgery. It's boutique, it's predictable, it's personalized, and it's permanent. And you know what? In 3 years of doing this, I can officially tell you that this model works both for patients and the surgeon. My concierge patients are by far the most satisfied with their experience and outcomes, and my job satisfaction has actually never been higher. But this isn't just VIP for the sake of it. It's about making sure you have the safest journey possible, the best experience possible, and the best outcome possible. Who knows, after your surgery, you might do something you haven't done before, like water ski or hike a mountain, or how about just walk around the block without pain? I'm more attentive, more energetic, and more invested in you than I've ever been before. Here's what this truly means for you. My patients tell me they feel valued, cared for, and never like they're just another case. You get direct access for all your questions, clarity at every step, and the comfort of knowing you're treated like an individual. So the elephant in the room is obvious. If I consciously choose to do fewer cases, will I lose my operative skills? I've thought about that a lot, which is why I've sought the balance of doing enough so that I'm always at my best, but not so many that I'm fatigued. Having done this for 25 years and performed almost 12,000 surgeries, I know that number for me is around 500 joint replacements per year. I just don't think I'm delivering a better product if I do 800 per year. My surgical skill does not improve from going from 520 to 800. My burnout factor does. And I still love this job and I want to do it for years to come. Does it make sense that I'm not signing too many surgeries up and I'm not getting burned out, that everybody benefits? This should be a once-in-a-lifetime journey. Don't you want the peace of mind knowing that you have all the things you need, you can do the surgery on your schedule, and have your surgeon on call for you? You focus on your recovery. I'll show you the way. Simple, effective, and elegant. Sometimes it's even more reassuring to listen to others who were once in your shoes and found their way to a renewed mobility and better quality of life. If you're interested in hearing directly from people who've experienced this approach, be sure to check out our patient success stories here on the channel. They're linked in the description below. You'll hear firsthand from real patients who've walked this journey, sharing their personal experiences, challenges, and triumphs. Now, this type of care isn't for everyone, and that's okay. If you value attention to detail, efficiency, and a premium experience, you'll thrive here. You won't be rushed in or out of the door, and you'll never feel lost in the shuffle. On the other hand, if you prefer a more traditional care pathway, I do have an offering for that as well. There are also plenty of other providers I work with that may be a better fit. I'm happy to help you decide for my more traditional historical pathway or help you decide on another provider. Every patient deserves a doctor to be at their absolute best, and that's what I strive to give you. Because to me, the secret to exceptional joint surgery results isn't doing more, but doing less, much better. I want to work with you when I'm at my best, not my busiest. There's no better investment than the one you make in your own freedom, the freedom to move with strength, without pain, and without hesitation. This joint will carry you every moment, every step for the rest of your life. This isn't just another procedure. It's your once-in-a-lifetime opportunity to reclaim your mobility. Choose to do it with a surgeon and a care model designed to give you nothing less than excellence. You're worth it. If you want a surgeon whose only focus on surgery day is you, while delivering care that's truly personalized, let's connect. Visit GoldbergHipAndKneeReplacement.com to claim your free one-on-one orthopedic consultation with our expert Austin care team. If this video brought you value, please subscribe and share it with anyone searching for the gold standard of orthopedic surgical care here in Austin. Help us reach others searching for real relief and return to freedom from pain and immobility. Thank you for watching, and remember, you deserve transformation.